My name is Alia Shamsi. I'm an author and an artist, as well as the host for Meem Voices. Meem Foundation is a philanthropic organization founded by Munal Gurk that focuses on women's economic empowerment and providing access to healthcare for women and children of the MENA region. Meem Voices is a podcast to amplify the power of women and girls across the region who are redefining what's possible economically, socially, and culturally. By the time you finish listening to this sentence, somewhere in the world, an AI system will have scanned hundreds of X-rays and spotted something a human doctor might have missed. But behind those algorithms are scientists, doctors, innovators asking deeper questions about trust, ethics, and equity in healthcare. My guest today is one of those people. Dr. Farah Shamout is a Rhodes Scholar, a scientist, and a thought leader in artificial intelligence for healthcare. She leads the Clinical Artificial Intelligence Lab at NYU Abu Dhabi, where her mission isn't just to make AI smarter, it's to make it fairer, more transparent, and more accessible to patients everywhere. Her work spans machine learning, biomedical engineering, and global health equity, and she's at the forefront of developing systems that could change how patient data is interpreted and used worldwide. But behind the titles and research papers is a story about why this matters and what it means when technology steps into the most human of spaces, our health. Today, we'll talk about the promise and limits of AI in medicine, the moments that have shaped her journey, and why she believes the future of healthcare depends as much on trust as it does on technology. And this conversation is part of the Meem Foundation podcast called Meem Voices, a space where we explore the ideas, people, and innovation shaping a better future for our communities. So in today's episode, we're bringing together Dr. Farah's pioneering work in AI with Meem's mission to inspire, educate, and empower, because when technology and humanity meet, the possibilities for impact are limitless. So we start with Dr. Farah Shamout. We're really excited to have you here today. So to talk about AI, healthcare, and the tools of the future of the industry as well, of healthcare industry. You're a scientist, an educator. It's very fascinating, your story, especially as a woman, an Arab woman in STEM, and also going into this entire new world of healthcare and AI. Maybe we can start a little bit of how did you get into this sort of field? New, but also very male-dominated.
So thank you for having me to begin with. So when I look back at how I got into AI in healthcare, I would say it was never really planned out. I usually just make decisions based on what I would say would lead to like better outcomes on the long term. And this is based on my father's advice. But I would say since I was in school and in high school, I was always interested in physics, math, sciences in general. And when I got to college, I applied for multiple engineering programs. And eventually, I think I was about to start with a major in mechanical engineering. But then I did some research, and the way this sort of research endeavor also started was based on like personal experiences in healthcare. So I had a few family members who I basically lost to cancer. So I just thought naively that maybe I can cure cancer through research. But I think that's sort of what ignited my initial interest in health specifically. And through my research experiences, that's when I also got the chance to code for the first time. And that really fascinated me. So I just decided to major in computer engineering, even though it wasn't popular at the time. And I was the only computer engineering major, but I was just like really interested in taking a leap of faith into tech. And I'm so glad I did that because technology now has the sort of biggest impact on our daily lives. And usually in computer engineering programs, there is a huge emphasis on both the hardware and the software. So by the time I was considering different graduate school options, I realized that any of the sort of hardware-oriented technologies I may be interested in building need some kind of data-driven algorithm. So that's how I sort of switched into data science and AI, but with a specific emphasis and focus on healthcare, because that was sort of the common thread within my education interests. And so I pursued graduate school in AI and healthcare, and I then moved back to NY Abu Dhabi to start my own research group called the Clinical AI Lab, where we still pursue projects related to AI in healthcare. But I think it all goes back to my interest in sciences to begin with.
Yeah. But see, that's really interesting because Dr. Farah, for example, I believe women can do almost it all and in terms of different professions. But why is it that it's always a struggle when it comes to STEM? Is it something that starts in the school? You enjoyed it. So, you had a passion for it.
So I would say I only came to realize that there are barriers to women entering STEM after I went to college. Because I think when I was in school, I just was lucky enough to have an amazing support system at home.
Yeah.
So I have two brothers, and my parents never made a distinction amongst us in terms of interests or things that we may pursue in the future. So I feel like that made a huge impact, a profound impact on my career choices. And going into university, I think that's when I realized that there are actual barriers to women beyond just education, because I think it's also about having career paths that would then cater to, for example, women also building personal lives or pursuing things that are not necessarily just career related, and ensuring that their career or sort of work environments also cater to that. So I think I've come to realize all of that at a later stage, but I would say it's a bit of both. There needs to be interest in STEM, and then we should also nurture that interest through programs. For example, I would have loved to learn computer science at an earlier stage, but I only got the chance to do that later on. So I think there's also a bit of that. And I think also mentorship, because I've had great teachers who made me like sciences and like STEM to begin with. But I've also heard horror stories of people who never enjoyed computer programming just because they weren't taught it right. So I think it's both the learning environment, but also creating awareness of what STEM careers could look like. Because I've also heard from some women who would just not be interested in pursuing something that is male dominated, in the sense that they wouldn't enjoy it because of those existing barriers. So I think it's a matter of also showing younger generations that they could break those glass ceilings and they can still have impactful and enjoyable careers in STEM.
No, it's super interesting. I read an article that was on the Economic Forum, and they were really talking about there's already this idea that STEM, a lot of women don't go into it. And it's really important, I think, from a data perspective, which maybe we'll go into a little bit in detail of what do you do at the Clinical AI Lab and how you sort of connect this tool, this AI tool, with healthcare, because there's data that's being collected, correct? And there's always these conversation about data bias that, and then there's also the question of how much is it relevant to the region in terms of, the patients. So if you can tell us a little bit of how you connect these two together and what is the output, let's say, that comes out of it as well.
So in terms of, I'd say just going back to the earlier point about women in STEM, we're pursuing STEM in the region. I think there was also some studies that showed that actually in the MENA region, there are more women pursuing STEM-related majors in college compared to other regions, even compared to North America. And the only sort of stage where they stop pursuing STEM is after they've graduated. And that's because of lack of opportunities for, I guess, further education, but also career opportunities. Now, in terms of what we do in the clinical AI lab, we work very closely with clinicians, and we basically try to identify clinical problems that would be tackled using AI or data-driven solutions. That's because we can't use AI for everything. So we want to make sure that whatever we build does have sorts of a clear clinical use case. And then we focus a lot on building like algorithms, models, and methodologies in order to make these models perform well, to ensure that they're robust, and that eventually would have some kind of clinical impact. So with a lot of it relies on data, as you've mentioned. So we work with either publicly available data sets or with private data sets collected at local institutions, because we're really like determined to build solutions that would also cater for local populations. And the main themes that we tackle relate to in-hospital clinical decision support. So how do we detect whether a patient will deteriorate while they're being hospitalized in order to design the right interventions, or we also build report generation or tools that would improve the efficiency of clinicians, because there's a huge there's a huge burnout amongst clinicians because of shortages of staff or lack of resources. And then the second theme is brain health. So we have a few projects where we're trying to predict, for example, the risk of stroke using cheaper data modalities that are easier to obtain. Because with stroke, for example, it's usually detected when it's too late. Now, the patient already shows symptoms of stroke. So we're trying to find solutions to predict who's at risk of having a stroke in the near future so we can intervene early. And then the third theme is women's health. So we have, for example, a project related to optimizing IVF treatment. We've done some work on breast cancer in collaboration with some of my colleagues in New York. But ultimately, our goal is to improve health and well-being on the long term.
That's, I think it is super fascinating, the idea that you can prevent things before they actually happen and detect. I mean, how precise is AI? And, how much intervention is needed from a human as well? So, can you just rely 100% on the AI tool, or is it a bit of both?
Yeah, that's a great question, actually. And it's an ongoing debate. Yeah. But I'd say in terms of precision, it all depends on the data. So as long as that you have large data sets of good quality, then you can train a good model. Because these models eventually learn from existing data sets that, for example, have some kind of label. Like if you're predicting breast cancer, so you're assuming that you have some images that have cancer or don't, and then some labels based on some ground truth, like histopathology results. So the quality of the model really depends on the quality of the data.
What is what would entail the quality? So
I would say your reference would be the current performance of humans. So how well can humans, for example, detect cancer?
Yeah.
And then with the AI model, the goal is to either match that. So you want to also cover scenarios where you have shortages of human radiologists, for example, or to beat that in order to do better in terms of performance. But we also have some studies where we've showed that actually having human in the loop can improve performance, especially if it's an experienced human, because then they might actually pick on things that the model is not picking up on. And we've shown, for example, that a hybrid solution could even work better in some scenarios. So I think ultimately the goal is to have autonomous AI models that can perform really well. But I think for the time being, having the human in the loop is also extremely beneficial, because we can also flag or even flag cases where the model is not confident about its own predictions, so we can get further expert review. And this way we're making sure that the AI models are safe, responsible, and that they're not causing harm.
Let's talk a little bit about AI. and sort of the attitude around AI. A lot of people think, it's very apocalyptic, it's going to take over the world, that, humans are not needed anymore, and a lot of professions are going. I mean, to what degree is it, within your field, is it a topic? Someone who's outside, it seems quite, like scary and dooming. But do you see something different in the future with AI? And is it really apocalyptic?
I wouldn't say it's apocalyptic, but I would say it's definitely going to change many professions, and it already is. So I think it's a matter of how do we teach individuals to use AI properly and to integrate it into what they're currently doing in order to just make their lives easier. Because eventually the way I view AI is it's a tool that can be used for either doing good, but also for automating things. For example, we had a huge discussion on whether or not we should allow students to use, for example, AI tools to write code. I teach some of those programming-based courses. And eventually, if they don't use it, then they're going to go into a workplace where others are using AI tools to be more efficient, whereas they're falling behind because they don't know how to use those tools. So I would say we should definitely teach everyone how to use them and understand the pros and cons of any AI model similar to any AI tools, because it is a double-edged sword. So we just need to make sure we're using it in the right way.
And I mean, like if we were to imagine a little bit of a future, one of those films, I mean, right now, there's this recognition, face recognition, and, eye retina recognition. If I would go in a hospital, what would it be like in 10 or 20 years' time? How would be the prognosis? How would they, is there something that's going to be very different in the way we experience healthcare?
Yeah, I think, so we're currently entering an era of what we describe as like multi-agent AI systems. So historically, we've had AI models where each model is specialized in a certain task. But we're now entering an era where the models can actually communicate and interact in order to make decisions or come up with plans. So I would say in 10 to 15 years in healthcare, or in even other sectors like education, I'd say we're going to be, AI is going to be sort of integrated into how we do things generally. So I would imagine going into a hospital, but you'd be interacting with an AI receptionist. You might even register before you arrive to the hospital. All of your data would be collected at home in advance of actually having to go to the hospital. But the way I would think about it as well is, I think in healthcare specifically, people usually go to the hospital when they're sick. But I think we're with greater research now going into longevity and healthy living, I hope that by then people would intervene prior to even getting sick, so they wouldn't have to get to the point of going to the hospital. I think there's definitely a huge hype around how AI is being reported in the media. So usually go back to the source. Many of those media hypes are based on like technical reports or papers that are published by tech companies or research groups. So we try to go back to the original source and understand what really was contributed there. But we're definitely excited by it because it's like a fast-moving field, and there are so many things coming up on a daily basis. So it's hard to even catch up with all the media hype. But we're very excited to be part of it.
No, I think it's very interesting, and I think when you mentioned that the percentage of women going into STEM from the Arab world, and I think there's also a lot of initiatives in the UAE around AI. So I think it's quite an interesting time to be able to go in at a very early stage as well. I know you also do a bit of policy making as well, correct? In the past. So with that, how important is it to lay the foundations for how we sort of integrate AI within the healthcare? Because there's this, there's generally, I'm someone I admit that going to the hospital is the last thing I want to do. When it's I'm really that. So there's also this idea of trust, and making it a little bit more accessible, but also accessible for those who are unable to. So I think it's two parts. Is like, how can we make it more of trustworthy for the general public, one, and how to make it accessible for those who maybe lack the facilities. Is it able to do something about that as well?
I would say that for the first part, it's all about like education and building awareness. So one of the things that I'm really passionate about is like first understanding what is the best way to teach AI to like children, elderly, the general audience, just to make sure that people understand what AI is and what it isn't. I mean, LLMs like ChatGPT and all of these large language models they became popular recently because they also became easily accessible. Mm-hmm. But that's just one piece of the AI puzzle, or sort of the work that we're doing towards artificial general intelligence, which is to mimic how humans think and do things. And in terms of accessibility, I think that's also something that really needs to be considered, because one of the fears is that those high resource hospitals will end up deploying state-of-the-art AI models, and they're going to be extremely high tech. And that's because they already have incredible infrastructure for data collection and processing. But then we're also going to see disparities being exacerbated in scenarios where there are hospitals that lack like MRI scans or don't have basic equipment. They just have a single PC that they're using to parse all of their data. So I think it's also about like building AI models that are not too expensive in terms of the infrastructure that is required to run them. So how do we build smaller models, efficient models, maybe models that would work on mobile devices, just in order to increase accessibility?
And is this something that is happening nowadays?
It is happening.
It's looked at to create models that are accessible, whether financially or even just in these remote areas.
Yeah, so there's like some research now going into like making these models more efficient, robust. Like there's some people looking into small LLMs, but it's still, I'd say, work in progress.
Mm-hmm.
But I think luckily, I'd say like mobile phones are everywhere, even in like underserved communities. Mobile phones are quite popular. So I think there's also space to innovate in that context in terms of bringing the AI to individuals through their mobile phones rather than having to go somewhere in order to access it. Mm-hmm. And I think that's what made ChatGPT extremely popular in that sense.
Yeah, the accessibility. However, maybe the question is, how much authority does, I'm saying, I'm not going to just single out ChatGPT, but generally these, let's say, AI tools in terms of advising. There's a tendency of asking a lot of whether it's therapy advice, cutting the therapist out, cutting the doctor out, dietitian, and then just going straight into these things. So I think awareness is important, but also to understand like the limitations of certain tools. And, is there a campaign towards sort of certifying certain AI tools from a medical, clinical or healthcare perspective?
Yeah, I think that's actually what scares me the most, because I've heard like horror stories of teenagers becoming attached to AI models, thinking that they're actually something. I mean, it's just a tool. But I'd say in healthcare specifically, there have been several research papers that have shown that actually AI models give good advice, but others that have shown just recently, a few days ago, that someone took ChatGPT's advice for a health condition and then they ended up in a very bad state. So I think we also need to consider like regulation and policy making in that space to ensure people are aware of how AI should not be used in that sense. I mean, last night I used ChatGPT to just ask how to deal with a toddler's bedtime routine.
Oh, okay. Was it helpful?
It was actually.
And it worked.
Yeah, I mean, it does give good advice, but that's because I also am familiar with how these models function. But I think for users who are not that familiar with how these AI models could be harmful, I can see it going into a gray zone. Yeah.
Let's go a little bit around the topic of women empowerment and women in STEM. How can we ensure that there is a legacy within the field? Because, unfortunately, like you were saying, a lot of women do have the degree, but then the job opportunities are a little bit, scarce. What is the role of, let's say, organizations such as Meem Foundation in really supporting women who want to go into this field?
The Meem Foundation is doing an amazing job in firstly advocating for bridging the gap and empowering women. And I think also in practice, there could be structural changes to actually support them practically. For example, training programs or mentorship programs are extremely effective in like bringing women together and also bringing role models into the picture and showing them what they could achieve. I think there should also be like larger research support and funding incentives to actually build the research infrastructure to help young talent pursue such opportunities. And the Meem Foundation is doing an impressive job in that regard in supporting both local talent, but also nurturing R&D on the long term.
I think that that's definitely something to sort of single out the talent at a very early stage. And but there's also sometimes, life happens. So what is a way to sort of build resilience for women in STEM and in, the tech industry? Again, like I'm someone who worked with an all male team. I was a photojournalist and I was the only female on that team. So again, there's almost like a double stigma. I am a woman, I'm Arab, and I'm a photojournalist. So, like there's a lot to prove. And sometimes it can be really difficult when you're the only one there. Is there a community that you can come together or support? Or do you believe in that? Or, how do you deal with these sort of, let's say, challenges, and this added pressure to perform, and to create something, because you already have that, but it's this additional that you're the only woman and you really want to prove,
I think there's like huge power in building communities. So for example, some of the effective ways I see in university campuses are those like smaller student interest groups where students come together to, like, for example, build a student club related to women in STEM. And this way they can make friendships, they can work closely together on projects they're interested in. I think it's quite empowering in that regard. And even for myself on the faculty level, like I find it quite empowering to have women colleagues who work in STEM as well, because then we can share lessons and challenges and reflect on what could be done in order to improve things.
So, Dr. Farah, let's talk about the region. I mean, you are an Arab researcher researching in the UAE with data of the region as well. So, what does that mean for a patient? I mean, in the past, a lot of my own family members had to travel abroad to get a diagnosis. What is going to be different from, having this facility in the UAE in terms of experience, but also process and relevance, maybe, of the data itself?
So, as I mentioned earlier, sort of the blood and bone of AI models is the data. And one of the things that we've seen in some of our research projects is that if you just take a model, for example, that was trained with patients from the UK and you deploy it here, might not actually perform as well for the local population as the data that it was trained with. So I think it's just the work that we're doing is, and what others are doing even in the UAE and the wider region for AI in healthcare, is really crucial, because we're building models that are customized for the data distributions in the region, just to make sure that they are optimal and work well enough.
Are they very unique? Because again, the UAE is quite diverse. So is it about diversity, or is there something that is a little bit different also within different diversities? I just find it fascinating to know, how different would the results be?
Like, for example, for the early warning model study that we did, and in that model, we're just trying to predict something simple, like, will this patient deteriorate? Will they get into the ICU or have cardiac arrest or, la samhallah, die? And the main sort of, or for example, difference between the local population and the UK population is the average age. Just generally, the average age in the UK is higher, which means if you can think about it in the context of, let's say, heart rate measurements, breathing rate measurements, and so on, the distribution of that would be different from what's here. So I would say it's less about like where the patient is coming from. It's more about what is their health status and what is the average health status in a certain community.
Is the health status something to do with lifestyle, or is it something to do with also, like temperature wise? Like right now it's hot. It's summer, we're here. But like, do things like this in terms of where you are living impact? Or is it really more of a lifestyle issue? And can AI detect things like this?
Yeah, I'd say it's lifestyle, but also connected to like comorbidities or family history, and that really impacts like future risk of developing certain diseases. But there are also some ideas now about looking at the impact of the environment, the air quality index, and all of that on health status. And that goes into the era of multimodal learning. So how do you combine data from different sources, not just the patient's vital signs, but also data related to their environment, as you suggested.
And sort of maybe tell us a little bit about the research that you're doing, and specifically the one that's connected with Meem Foundation. What are you looking at exactly?
So with the support of the Meem Foundation, we're pursuing many exciting projects. Within the context, for example, of women's health, we're looking into other research questions related to optimizing the full IVF pipeline. So how do we go beyond just tracking embryos in order to like assist embryologists in just making their workload more manageable, but also predicting different pregnancy outcomes and putting everything together within that super complicated process. We have another project related to democratizing access to large language models in the context of actually getting care. For example, in the context of telemedicine or telehealth. So for that, we're constructing unique large data sets.
Can I ask a little bit about
telehealth?
Yeah.
So it's like getting healthcare services at a distance. So
it's like
you don't have to go to the hospital.
So what, like we had in COVID back in the day, that you would be able to talk to a doctor on screen?
Yes.
Okay.
So some ideas now that are appearing is actually having like an AI agent or avatar talk to patients from afar.
Yeah.
But for some of the work that we did, we showed that by just relying on even simply language, these models don't perform as well for Arabic compared to English. So we're building data sets that could help us tune those models so they can perform better. And at the same time, we actually want to investigate how these models would interact in real-world scenarios with clinicians and patients in order to make them work better.
So basically, are we talking about the language in terms of the Arabic language? The way, certain questions will be, it's like a questionnaire, is it?
I think it's as simple as asking a question like, what do you think these symptoms are for? So how would this question manifest in Arabic in terms of dialects? Would the AI model understand that? In terms of semantics? So it's just like, how do we maximize the performance of these models in the context of the Arabic language?
So these models already exist and are like, but it's sort of the application of it from a regional MENA perspective, let's say, is it?
Regional and application.
Okay.
So because there are some models now that are general, so they can be used for any purpose, but there's also a lot of effort going into building healthcare specific models. So how do the general models and the healthcare specific models work in the context of Arabic speaking populations?
How do you imagine these things just like this idea comes to you, or Is it a need that, you're trying to tackle?
I'd say it's identifying needs, but based on collaboration. And I'd say the best kinds of projects are collaborative projects. So it's by speaking to the end user. So how do patients or even ourselves, how do we experience healthcare systems? I mean, whenever I go to the hospital, I try to think about what are the different problems that we can optimize research-wise, but also by speaking to clinicians, to healthcare practitioners, and by speaking to other scientists. And I'd say one of the best ways of ideating is by working with students, because students also don't have like an understanding of the kind of restrictions that may occur in bringing things into the real world because of, let's say, bureaucracy. So they actually come up with really cool ideas that we then pursue together.
Okay. So are you optimistic?
When it comes to AI?
Yeah, and healthcare.
Very optimistic when it comes to AI and healthcare. AI in general, maybe I am optimistic, but I also am conscious of the things that we should do better from, let's say, a privacy and bias and fairness perspective.
And if you were to sort of just single out one thing that you can predict for the future of AI in healthcare, like one experience.
I imagine that we may each end up with some kind of AI buddy or health buddy that can help us keep track of maybe our health habits or predict our risk for certain diseases. And then this AI buddy can help us live a healthier life. At least this is how I'm imagining it.
Yeah.
Yeah.
No, that's great. You have a little buddy with you along the way.
Yeah.
Making sure you're healthy at all times. But I think that's the beauty of, I think, when you take technology and apply it for something of meaning. And it's a wonderful conversation to have had with you, Dr. Farah. Really for me, was really learning of the benefits of AI at a time that we hear a lot of like negative hype around the subject. But this is why we have AI, is really to make our lives better, provide better opportunities as well. And I think it's phenomenal, everything that you're doing, honestly. And I wish you all the best of luck. And I cannot wait to hear the final project come to life with Meem Foundation. But yeah, thank you.
Thank you for having me.